Some of the first things you notice as you age are smack dab on your face. Are there lines around your mouth, even if you don't smoke? Or do you feel like your eyes are more hollow? Well, these are things that happen naturally and things that can be fixed with just a little help. So Dr. Ann of Ann Teresa Aesthetic Medicine is here with more. Good to see you, Dr. Ann.
Thanks for having me.
So first of all, what happens to our face as we age, I should say?
Well, basically we lose volume. So we lose volume in certain areas like the temples, we lose it in the mid-face and the cheeks, and we lose it right back here by the ear and a little bit in the chin. And what that tends to do is make everything feel like it's coming downward. So we kind of get this rotational descent of all the skin when we lose those fat pads underneath it.
And here's something that might be a little bit depressing, but we can't count on this happening when we're 70 or 80, right? This kind of starts pretty young.
It does, and tragically our collagen stops being promoted unless we do something to stimulate it at age 28. So we need to do something to help the collagen remain in the skin, and then we also like to do some things to kind of bolster the fat pads that we're losing. And we're seeing kind of a diagram here of what our face looks like, very triangular shaped in the 20s. 30s and 40s, it gets a little more boxy, and by 50 plus, we tend to have the jowling kind of setting in, and you can see the very kind of boxy look to the lower face. And I find that a lot of people, men and women alike, will come into the office, and what they're bothered by most is their lower face, the jowling, the lines around the mouth, just some of the smile lines that set in, and mostly the boxy look to the lower face. We want that volume kind of going upward and that triangular, youthful look back.
And you mentioned man and a woman, because that happens to both of us as we age.
Does.
It's not just a female thing.
It's just not a female thing. You can see in these two pictures here, lady is beautiful on the left, but some fine lines around her mouth. The upper lip thins as we age. The gentleman on the right is showing the same thing. We get the kind of shortening of the chin, that crease in the chin. The upper lip thins, and it's almost gone as we age in our 70s and 80s. And then the deeper folds around the nose, the nasolabial folds, and the downward turn to the mouth, kind of almost like the marionette lines that some people complain of. They almost feel like the mouth is turning downward and everything's just coming, you know, the jowling and the downward turn.
You look unhappy.
You look like you're frowning even when you're not.
When you're not.
Yes.
So we want to get rid of that. And your team has many options. So what can be done about these things?
Well, these are areas, as we talked about, where there's volume loss. So fillers are a wonderful option. This picture here, we're seeing her before picture on the right. You can see a fair amount of jowling, the downward turn to the mouth, the thinner upper lip. And so the blue and the red lines, the blue lines are where I put a thicker filler, something with a little more lift and more robust nature. And then we did that in the nasolabial folds and right around her jawline at the corner of the mouth. And then the red lines are where we put a thinner or maybe a softer filler in the border of the lip to kind of reestablish the lip border and treat those fine vertical lines around her lips. And you can see in the end picture on the right is the after picture. It's much softer, still looks like her, didn't give her huge lips that would not look like appropriate for her age, but basically reestablished the lip border. We reestablished what are called the philtral columns right there in the Cupid's bow. And then we softened that nasolabial fold and softened that downward turn to the mouth to kind of give her back her jawline there without it looking like everything was coming down. And all that was done with fillers.
And let's move through. Yeah, we have a couple other before and afters. This one to me, I mean, not only does it obviously change, you know, the fact that you have fuller lips and you can see that in her, but she doesn't look not like herself, which is one of the biggest things that you get from patients,
Exactly.
right?
I think that you touched on a great point there. People are sometimes fearful of fillers because they think they're not going to look like themselves or they're going to look overdone. And I think sometimes some of the Hollywood folks that have gone overboard with the lips that enter the room before they do, people are fearful of that. They want to look, I always say we're in the Midwest. This is not an extreme makeover. This is the Midwest makeover. We're just softening things. And the best compliment is you look better and people don't know what exactly somebody did, but they just know they look a little bit better.
All right, so call Dr. Ann. They always have a complimentary consultation for you. And today's offer, buy 2 Voluma, get 1 free Juvederm. So I'm sure you can do a lot with that, right?
Exactly. Voluma is a thicker filler where we could fill some of the deeper folds. Juvederm is a perfect filler for the fine lines around the lips or just maybe some lines down here that bother people when they smile. So combination of one of the more robust or thicker fillers with one of the more softer fillers is a nice one for lower face rejuvenation.
All right, there you have it. Give Dr. Ann's office a call. Thank you so much, Dr. Ann.
Thanks for having me.